if you're going to take these medicines, it's really important to make sure that you're getting a high protein diet, that you're getting some regular strength training in, and also that you're monitoring the pace of your weight loss. Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey friends, welcome back to today's episode. Today we are going to talk about something that comes up every day in my clinic. And not just every day, honestly, multiple times through the day. I'm going to throw out a couple words and stop me if you've ever heard any of these. They are Semaglutide, Tirzepatide, Ozempic, Mounjaro, Wegovy, Zepbound. Are those familiar words to you? I am sure they are. In the last year or two, there has been such a boom around GLP-1 medications, and I know that my patients come in and have questions about them, and sometimes even when they're asking me questions about them, I'll stop and say, first, tell me what you know about these medicines. And sometimes, y'all, I am full out surprised at the things people say, and sometimes they say things that are so out there that I say, where did you get this information from? And without a doubt, usually that information is either coming from TikTok or Facebook, or they got info from a friend or a friend of a friend of a friend. Either way, they're not generally coming from healthcare professionals. And so I want to take a little bit of time today just to share with you 5 things that I think you need to know about these drugs. Now, I'm going to start off, this is my disclaimer for literally every episode of this podcast, by saying that the information that I'm giving here is just that. It is for informational purposes only. I want to encourage you to consult with your physician, talk with your own personal healthcare provider if you've got specific questions or want more personalized guidance to your own case. But let's get into these medicines. So I started earlier with giving you a couple names. I'm sure you've heard some of those before, if not all of them. I want to start by breaking that down just a little bit more. Now, I'm giving some brand names, and it's easier for me sometimes to talk about them in brand names, so I may go back and forth a little bit, but no one is sponsoring this show, so I'm going to use names interchangeably, okay? So when I say semaglutide, I want you to also think about Ozempic and then think about Wegovy. So all of those, both Ozempic and Wegovy, are both semaglutides. Likewise, Tirzepatide is the name for this other medicine, and Mounjaro and Zepbound are the brand versions. I may get a little specific with names later, but in general, I want to talk about just the whole class of medicine. So this class of medicine is called GLP-1s, and that takes me to point number 1. Remember I said we're going to talk about 5 things that I think you need to know about these medicines. So the first is that they mimic a natural hormone. So a natural hormone in our body called GLP-1, and GLP-1 stands for glucagon-like peptide 1. And again, this is a natural hormone in our body that helps us to regulate our blood sugar and our appetite. So to give you just a little bit of background or maybe some other just basic information about GLP-1 that is naturally occurring in our body. So it's produced in our intestines, and it works by telling the pancreas when to release insulin. So imagine you're eating something and your blood levels go up, which is what happens when we take in food. What GLP-1 does naturally in our body, it says to your pancreas, hey, there's a sugar load there. Go ahead and release some insulin to combat that sugar load that this person is having after taking in food. So, a little caveat here is that in people who have type 2 diabetes, their GLP-1 may not work as effectively as we want it to. And so that's why sometimes they don't have good blood sugar control, which is why GLP-1s are good medicines for diabetes. But again, getting back to that natural hormone, I'm getting off track here. So, one of the ways it works then in our body is it tells our pancreas to release insulin. The second thing that GLP-1 does is it slows down gastric emptying. So, when I say gastric emptying, what I mean basically is the movement of food from your stomach into the small intestine. And so, think about it, if food isn't moving very quickly from the stomach to the small intestine, then a person is going to feel more full. So, they're going to have kind of increased satiety or that feeling of being full. And it's going to make them eat less and it's going to make them feel full for a longer period of time. So you get this slowing of gastric emptying, which also gives a signal to the brain of feeling full. So I sometimes say to my patients that one of the ways this medicine works is it kind of turns off this feeling of being hungry and turns on this feeling of being full. So that's how natural GLP-1 works in our bodies. Now, these medications are synthetic or man-made versions of this natural hormone. So what it does then is it mimics the effects of natural GLP-1 in our body, but the synthetic version of it makes it last for a longer period of time. And so that is why we see the weight loss that comes along with it, because you have a patient who, again, is feeling full for a longer period of time, who's not as hungry, and therefore they're not eating as much. So not only is this GLP-1, the medication, making our body release more insulin to drop our blood sugars, but it is leading to weight loss as well, which is why when these medicines were first created, and let's be clear, these medicines, even though they've been the hype in the last 1 or 2 years or last maybe 5 years or so, these medicines were created much earlier than that. I can think back to my training and we were using GLP-1. So other names of ones that may ring a bell to you are Byetta or Victoza, Saxenda. These were medicines. Byetta, I believe, was the earliest one that was approved by the FDA in 2005. So since 2005, these medicines have been used for diabetes control. And so that leads us to point number 2 that I want you to know about these medicines. So number 1, again, was that they mimic a natural hormone, this GLP-1 hormone in our body. Point number 2 is that they are primarily for type 2 diabetes and obesity. So I've already explained why these medicines work for type 2 diabetes. Again, the big push there is going to be stimulating that release of insulin, and so it allows people to improve their blood sugar. But that weight loss also helps with diabetes control as well. And so when these medicines were initially approved, again, they were approved for the management of type 2 diabetes. And even, I'm going to use name brands now, so Ozempic and Mounjaro. So those being kind of those ones that were initially out there, we realized that people who had diabetes were getting such great weight loss with it. And then next thing you know, everybody wanted them. I mean, there were celebrities coming on TV saying that they were taking these medicines. And when that happened, it took off like wildfire. So then you have people who truly have diabetes and need their pancreas to be releasing more insulin when they take in high sugar loads. And all of a sudden, they couldn't get those medicines that had been working so well for them before because everyone else then wanted these medicines too. And so if you remember, especially if you have type 2 diabetes and at that time you were trying to get the medicine, there were shortages on Ozempic and Mounjaro. People just couldn't get them. And so we saw these medicines were on back order. People were kind of rationing out their supply. And instead of taking them once a week, they were taking them every other week. And these folks just weren't getting the good blood sugar control that they needed because they were having to stretch these medicines. At the same time, we saw manufacturing companies start making compounded versions of these medicines. And so then you saw people getting the medicine Semaglutide, which the brand name at that time was Ozempic, or getting the medication named Tirzepatide, and then the brand name of it was Mounjaro, people getting these from compounding pharmacies. I want to say here also that the idea of compounding is not new either. Pharmacies have long been compounding medications. You have some physicians who compound medications, other specialists who compound medications as well. And it's traditionally been something that has been really beneficial to patients. So think about having the ability to provide a medication for a person if they can't take a name brand version, or if they have, so for example, if they have an allergy to something that's in a medication. Well, this person can't take this branded form of it, so pharmacies then would compound a special version of it. So that's kind of the background of compounding medicines. But here, with this big push for these weight loss once weekly injectables, we started to see this big uptick of pharmacies and manufacturers compounding semaglutide and tirzepatide and selling them for literally whatever they wanted to sell them for. And people bought them, and they bought them because they wanted to see that weight loss that so many were getting with these GLP-1 medicines. So after a while, the pharmaceutical companies caught on to this, right? And they said, well, wait a minute, what can we do to put our hands back in this and make sure that this money is coming to us and not going somewhere else? And so you saw then this shift from Ozempic to Wegovy and from Mounjaro to Zepbound. And so still now you have a separation of those things. You have Ozempic, which is used for type 2 diabetes, and you have that same semaglutide medicine that we see in Ozempic that is now Wegovy, same exact medicine. Sometimes the dosing gets a little bit different, but still at its core it is semaglutide, but that medicine is approved for weight loss. And then you have Mounjaro, which is Tirzepatide, and Mounjaro is the form for the treatment of diabetes, but Zepbound is the medication form for weight loss. So in talking about point number 2 that I want you to know, it is that these medicines are primarily for type 2 diabetes and for obesity. So type 2 diabetes is easy to put a title on. So if you meet the criteria by definition for type 2 diabetes, then there you go. For obesity, though, when we think of the ideal candidate for this medicine and we think of what it was FDA approved for when we're talking about Wegovy and Zepbound, they were approved for people with a BMI of 30 or greater, or someone with a BMI of 27 plus a comorbidity. And so when we say comorbidity, think about, chronic disease, so like high blood pressure or heart disease, these wide variety of chronic conditions people have that may allow them to have a little bit lower BMI, but also be at high risk and high need to have some weight loss. The point that I want to make here is that, again, FDA approved for type 2 diabetes and people with obesity. We want to not think about GLP-1s as being a quick fix medicine. So, they truly are for people who have these diagnoses and whose lives will be made better by getting the weight loss. And a lot of times these are folks who have tried all kinds of things already and haven't been able to lose the weight. And so I tell my patients often, I'm not comfortable prescribing this medicine for you to lose 10 pounds so you can fit in a bridesmaid's dress in a couple weeks. Like, that's not the idea of the medicine. For so long in medicine, we have seen patients come in and out of the clinic setting who are concerned about their weight, who are truly obese, who you can look at sometimes and see their lab results and just talk to them and realize that they are set up for bad things to happen down the road if they can't lose weight. And they've tried the exercise, they've tried to make the dietary modifications. So I do think these medicines hold an important role, but I also feel like they should be reserved for people who, one, have started trying to make those lifestyle changes, because as we'll talk about a little bit later, that need for change is still there. It's not just us being able to rely on the medicines alone. So point 1 that I want you to know is that these medicines mimic a natural hormone. Point 2 is that they are primarily for type 2 diabetes and obesity. Point 3 is that they can have side effects. And if you've ever taken any of these medicines, or even if you know somebody who's taken these medicines, you probably have already heard about the side effects that come with them. So remember earlier that I said one of the ways GLP-1 works is that it slows down gastric emptying. So if you're having a delayed release of food from your stomach to your small intestine, then sometimes that's going to come with feelings of being nauseated or bloating. Some people may have vomiting or diarrhea or constipation. So there's kind of a wide range of GI side effects that we see with these medicines. Now, that typically is mild. In some patients, it can be a little bit more significant, but typically it's mild and usually it's temporary. So we see it in folks when they are just starting the medication or when they're having a dose adjustment to the medication. Another side effect that we see sometimes with these medicines is muscle wasting. And that muscle wasting is generally because people are losing weight. I mean, you see muscle wasting with anyone who's losing weight. It's not specific to the medication, it's more related to losing a significant amount of weight in a short period of time. And so you've all probably seen someone that you can just look at and say, I think they're overdoing it a little bit on their GLP-1. And what you're trying to describe, even if you can't put a term to it, is that that person's probably having some muscle wasting. And so we talk to folks about if you're going to take these medicines, it's really important to make sure that you're getting a high protein diet, that you're getting some regular strength training in, and also that you're monitoring the pace of your weight loss. So that's another side effect that we see with the medicine sometimes. Now, there are some less common but pretty serious side effects also. I'll give you a couple examples. One is pancreatitis, we can see sometimes in people who take this medicine, gallbladder issues. And so, if you have a history of any of these problems, it's really important, again, and always important before you start any medication, that you talk with your physician about it. Now, I want to highlight that not everyone experiences the same side effects, and severity really does vary kind of person to person. And so that's something to think about. So, point number 4 is that access and cost can be significant barriers for some people. So, as I mentioned earlier, initially, one of the biggest barriers that we saw to these medications was people not being able to find it. So, people who needed the Ozempic and the Mounjaro for their diabetes control couldn't get it because all these people were trying to get it for weight loss. What we see now, though, with Wegovy and Zepbound, so people who want to take these medicines for weight loss, for what they're FDA approved for, is that cost can be a significant barrier. So you've got people who have been in the past paying upwards of $1,200, $1,300, $1,400 for these medications. Now, in the last couple of weeks to months from the time that this airs, those pharmaceutical companies have started to lower the costs of it, but still they're around $400 to $500 a month for these medications. What we also are seeing is that some insurance companies, even for people who need the medications for diabetes, they're having a harder time getting them approved. And so, as a physician in my office, we're having to do prior authorizations. We're having to prove, yes, this person does have diabetes. Here are their numbers. Here are the medicines they've tried. I really believe this medicine would be a good option for them. And so there are a lot of kind of hoops that we have to jump through, even to get patients with diabetes these medicines that are so helpful to them. But usually in someone who has diabetes, more times than not, now not always, but more times than not, you can get it covered. But sometimes for folks who are taking these medicines for weight loss alone, they're having to pay out of pocket for them. And that cost alone is a barrier for a lot of people. And so I mentioned earlier that we have so many people who have tried everything to lose weight. And here now we have a pretty decent option of a medicine to help them lose weight, but it's pretty significantly costly. So let's recap the points so far. So point number 1 that I want you to know about these medicines is that they mimic a natural hormone in our body. Point number 2 is that they are primarily for type 2 diabetes and obesity. Point number 3 is that they can have some side effects and are not necessarily the best choice for every patient. That should be discussed with your physician. And point number 4, that access and cost can really be true barriers to being able to take these medicines, to get them, and to be able to afford them. Point number 4, and this is really important, and this is that these medicines are a part of a broader landscape of treatment. So what I mean by that is that yes, GLP-1s are effective, but they are most effective when we are combining them with those things that we already know, when we're combining them with a healthy diet, with regular exercise, with lifestyle changes. All those things, if you remember, I did a really great episode with my friend Suzanne Henson, who's a registered dietitian and nutritionist, and she talked about so many food changes that were really important for us to make to get to a healthy lifestyle. We called it Ditch the Diet, Embrace Real Nutrition. And I love that title because we want to get away from thinking about kind of quick fixes. I know I've used that term already in this episode, but we do want to push ourselves away from thinking of what is a quick fix that I can do to lose a couple pounds right now and get to where we're thinking about long-term changes. So again, GLP-1s are going to be most effective when we're combining them with a healthy diet and regular exercise, when we're making those lifestyle changes that we need. Also want to keep in mind that GLP-1s, especially in the case of diabetes, are just one tool that's in our toolbox. There are other medicines that are out there that we can do for treatment of type 2 diabetes, especially if we get to a space where these medicines are not affordable or, if ever there was to be another issue of being able to access them because of shortages or other reasons. And so the other thing to know is that there's still ongoing research. So one of the big lasting questions out there is, if I start this medicine, how long am I going to have to take it? And I honestly, for my patients, don't always have the best answer for that. I say, our goal is to get you to a healthy weight, to get you to where your blood sugars are controlled. And then we may think about bringing down the dose to get to a dose that's sustainable for a long period of time. Just like most other medicines that we take. So think about somebody who has high blood pressure. Well, when you start a blood pressure medication, yes, your blood pressure goes down, it gets better. But a lot of times if we stop that blood pressure medicine, in most people, their blood pressure is going to tip back up a little bit. And so I use that sometimes as an example to my patients to say, this medicine may be something that you're going to be taking long term. Now, I can't put a date on how long term is, but it may be for many, many years. And so when we go into it for diabetes thinking it's long term, then sometimes people are okay with that, because just like they're going to be taking their other diabetes medicines for the rest of their lives, this is just another medicine that's used to treat their chronic disease. But we should think about it as weight loss in kind of the same way, and especially if we're not able to make those other lifestyle modifications that I talked about earlier that have to happen. And so do I see people all the time who take GLP-1s for months or even years, and then they're able to stop the medicines and maintain their weight loss? Absolutely. But those are the people that while they were taking the medicine, they were also making those big changes that were going to be necessary for them to sustain that weight that they got to for a long period of time. So let's summarize again. We're going to recap those 5 things that I think everyone should know about these GLP-1 medicines. They mimic a natural hormone in our body. They're primarily for type 2 diabetes and obesity. They can have side effects. Access and cost can be significant barriers. And 5, they are part of a broader landscape of treatment. So I encourage you, if you have questions about these medicines before you, take a friend's medication or before you order it online or something like that, otherwise, have a discussion with your physician about it. Get your labs checked, make sure that you are an appropriate candidate for the medicine. Talk to your physician about your family history. People who have certain things in their family history, specifically like history of thyroid cancers, should not take this medicine. We mentioned, pancreatitis and gallbladder issues being possible earlier. So if you have a history of any of these things, it's really important that you have a discussion with your healthcare provider to determine if these medications are appropriate for you. So I just wanted to give you some facts and discuss some things that I think we should know about these medications. They're certainly out there. There's so many people who are taking them, and I want to make sure that you, my listeners, have some good information. Thanks for sticking through to the end. Consider sharing this episode with someone that you know who could benefit from it as well. If you're not already a part of our Facebook group, come join us. And if you haven't done so already, make sure that you subscribe to follow the show so you can see new episodes when they come. And if you're learning anything on the show, feel free to leave a review. Thank you again. I'll be here next week. Bye. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.